Hello everyone, this is Dr. Shravani Pulluri, Clinical Director, Nest Fertility Center, Madinaguda. So today we'll discuss on a topic called what are the scans that usually doctors advise in pregnancy. So first of all, when your pregnancy is confirmed on a blood test or a urine test, we immediately advise a scan called confirmatory scan. So why do we do this scan? Immediately you skip your period. So it's usually done at 5 weeks. So why do we usually do this? So this is done to mainly rule out ectopic pregnancy. When your pregnancy is confirmed, this scan has a major importance because first we have to confirm whether the sac is in the uterus or not. So if the sac is not present in the uterus, then we should think of other suspicion that whether the sac might be in the tube or anywhere in the body, which is called heterotropic pregnancy. So if the sac is in the tube, then it is a alarming sign that you have to terminate the pregnancy. So to rule out any complications that people face because of ectopic pregnancy, we usually advise this confirmatory scan, and once the sac is in the uterus on the scan, then it is a sign of relief. Then the next scan when we usually advise is at the period of gestation 7 weeks. So why do we advise this scan? In this scan, we usually measure the CRL, that is the crown rump length of the fetus. So you can see the fetal pole, yolk sac and the crown lump length. It should correspond to the gestational age of the woman. So according to your last period date. So at 7 weeks, we can usually see the heartbeat of the fetus also, and you can record the heartbeat also. What is the heartbeat, either 146 or 156, whatever you can record it on the scan. And the next scan, we usually repeat it at the period of 9 weeks. So why do we repeat the scan immediately after 2 weeks? So because the chances of missed abortion, the chances of the heartbeat being stopped is more in the first trimester. We usually repeat the scan at a period of every 2 weeks till the 12th week scan, that is the NT scan. So that's why the next scan will be at 9 weeks. In this, we usually confirm the growth of the fetus, whether it is corresponding to the period of gestation or not, and whether the heartbeat is fine or not. So after the 9th week scan, the next scan what we advise is at a period of 12th week. So at this period, we usually advise for a scan called NT and NB scan. NT is knuckle translucency and NB is nasal bone scan. So why do we do this scan? So what is knuckle translucency? So knuckle translucency is nothing but we see the fat behind the neck of the fetus, so that if the thickness is increased, then it is a sign, one of the sign for Down syndrome. And if the nasal bone is present or not. If the nasal bone is absent, that is also one of the sign for Down syndrome. So to rule out all these, we usually do this scan, and if the nasal bone is present and the NT is within the normal limits, then it is a sigh of relief and it is a normal pregnancy. Then after this, the next scan would be at a period of 20 to 22 weeks. This is called as Tifa Scan. Importance of this scan is to rule out any anomalies that are present in the fetus. So this is a very detailed scan that is done by a radiologist or a fetal medicine specialist to rule out any fetal abnormalities, whether it is in the legs or hands or it is in the brain or heart. So they do a very detailed scan. So in this, we'll get to know if there are any abnormalities present in the fetus or not. So after the 5th month scan, then the next scan would be at a period of 28 to 30 weeks. This is usually called as a growth scan. We usually do this to see the growth of the baby, and we check for the amniotic fluid, whether it is in the normal limits or not. And we also check for the position of the placenta, whether it is anterior or posterior or it is low lying. And we also check for the Doppler, that is the blood supply to the fetus, whether it is normal or not. And the next scan after this scan would be at a period of 36 to 37 weeks. This is also called as a growth scan. This is the final scan in your pregnancy. So why do we do this scan? And what all we check in this? So this is usually done to see the final weight of the baby before delivery. and also the position of the placenta as well as the amniotic fluid. How much is the fluid, whether it is adequate or not, and how is the position of the placenta, and as well as what is the weight of the baby, as well as Doppler abnormalities, whether the blood supply to the baby is good or not, or whether there is any reversal in the flow. All these parameters we check in the final scan. So after this scan, then you can finally go for delivery. So these are the main preliminary scans that we do in pregnancy. And in addition to this, if the pregnancy is a complicated one, whether there are any Doppler changes, or whether if the amniotic fluid is not adequate, then your gynecologist might repeat some scans in between as well. So if you have any doubts regarding the scans to be done in pregnancy, as well as the importance of each scan in pregnancy, then you can feel free to visit Nest Fertility Center, Madinaguda, and as well as please subscribe our channel and please press the bell icon below. Thank you.